Presidential Task Force says more than 4,000 Lagosians presently undergoing COVID-19 home treatment amid second wave. Federal government insists no fresh lockdown in sight. In international news, debate arises in Germany over privileges for people vaccinated against COVID-19. And in sport, Tottenham's former boss Mauricio Pochettino is Paris Saint-Germain's new coach.
This is ANN News.
I am Olajumoke Olatuji. Nigeria recorded more than 1,000 cases of new coronavirus infections on Monday, raising the total number of cases to 91,351. This is the second time the country has recorded infections in 4 digits, first time in mid-December. Seven casualties were recorded in the previous 24 hours, bringing the country's death toll to 1,318. Lagos, epicenter of the virus, recorded most of the new cases with 654 infections. FCT had 200. 19 other states shared the rest of the cases in lesser numbers. NCDC says a multi-sectoral National Emergency Operations Center has been activated at Level 3 to coordinate the national response activities as the country goes through a second wave of the pandemic. Lagos State Commissioner for Health, Professor Akin Abayomi, has confirmed that at least 4,000 persons infected with coronavirus in Lagos State are currently undergoing home-based treatment. Abayomi says 115 persons are also in isolation centers across the state. He put the number of COVID-19 patients discharged from Lagos care centers at 2,900, while 3 new coronavirus-related deaths were recorded. Total COVID-19 induced fatalities in the states now stands at 240. The commissioner also identified Etiosa, Ajeromi, Surulere, Amuwodofi, and Motion local government areas as the state's 5 top high-burden LGAs. Meanwhile, the federal government insists that for now, there are no plans to impose a fresh lockdown on the country, even in light of the second wave of the virus. Minister of Information and Culture, Lai Mohammed, said this at a press conference in Lagos while appealing to Nigerians to adhere to all protocols outlined by the Presidential Task Force on COVID-19. He says there are no plans for now because the federal government understands the economic and social implications of a second lockdown. The new variant of the coronavirus currently causing panic and concern in the United Kingdom and the European Union has been identified in Nigeria by scientists at the African Center of Excellence for Genomics of Infectious Diseases at the Redeemers University in Ede, Osun State. Respondent Deji Badmus has that story.
Nigeria recorded its highest infection rate in a single week to date this past week. Authorities are calling it the country's worst period since the outbreak of the virus.
Our TPR analysis shows that 16 out of every 100 tests carried out are positive. We are also seeing increasing transmission among younger people.
Our treatment centers are filling up. We're struggling to keep up. We're struggling to find the facilities to manage, the oxygen to manage. Every night we're faced with phone calls of patients desperate for care.
Infections began climbing in December, leading authorities to declare a second wave of the pandemic. Health authorities suspect a new variant of the virus detected in the UK could be partly responsible for the recent spike.
We suspect that this variant is already in Nigeria. It will be surprising if it is not, but we simply don't know yet. So what we are doing are collecting samples of recently diagnosed cases and working to do the sequencing that we need to do in order to verify if this variant exists in Nigeria or not.
The government has now placed tighter restrictions on passengers flying into the country from the UK and South Africa, which has detected separate variant of the virus. It also reinstated some of the earlier restrictions it lifted.
The other challenge that we're facing, apart from the challenge of the outbreak, is an increasing outbreak of misinformation. Every day we receive broadcast messages on WhatsApp, people sending forth messages that are unsubstantiated and in fact wrong.
With the increasing number of infections, the government has ordered the reopening of isolation centers. The commercial capital Lagos is the epicenter of the outbreak in the country. Authorities here are increasing testing capacity and setting up oxygen sample sites for patients with severe cases.
An oxygen sample site is a permanent structure, and there are 10 of them across Lagos. So if you can't get to one of our isolation centers and you need oxygen, all you need to do is go to one of these centers and you can be managed there. We give you enough oxygen till you calm down. We start some treatment before we transfer you to an isolation center.
A COVID-19 vaccine is expected in January. In the meantime, the government is appealing to the public to comply with preventive measures.
The National Association of Nigerian Students is asking for an inclusion of universal students NAS in the federal government's conditional cash transfer program. NAS President Sunday Asefun says this will go a long way in assisting the active demography of the Nigerian population because students have been marginalized in various government programs aimed at combating the harsh economic realities. Asefun also announced NAS would launch an e-platform for Nigerian students to report cases of sexual harassment, intimidation, wrongful suspension or expulsion, and other vices in 2021. The National Cash Transfer Program, which began 5 years ago, is one of the federal government's 4 social investments programs. Beneficiaries of this program are from the National Social Register, comprising state social registers of poor and vulnerable households.
Coming up, African stories. Concern heightens over alarming numbers of virus-related teacher deaths in South Africa. And later, international stories. Debate arises in Germany over privileges for people vaccinated against COVID-19.
You are watching ANN.
Susu is fine. No, she's not crying, oh. But we are watching cartoon. Ask grandma, I'm the one that used to take care of Yabo that time. Take your time.
They cry, oh, daddy, oh, daddy, oh.
I will call you back. Your daddy is calling.
Explore without limits. Turn it up on MTN, the reliable data network.
Everybody say.
Welcome back. This is ANN News. South Africa faces a shortage of teachers as a result of unprecedented COVID-19 death toll. The country's Department of Education has issued an alarming statement that the total number of teachers who have been killed by COVID-19 has left them with a shortage as they enter a new academic year. Correspondent Yolisa Injamela has the story.
The COVID-19 pandemic has taken a huge toll on South Africa's education system. About 1,500 teachers have succumbed to the virus. In the past week alone, the virus claimed the lives of 32 teachers in one province.
That's a large number. It means that there will be some schools where several teachers will not be available, but it also means that there will be classrooms where there will be no teachers. So that to us is a huge concern. It is a looming crisis because we planned with these teachers in mind that they will be coming back to work. And when we finalized our admissions for the following year, the ratio was based on the number of teachers that we already have. And this number from just one reporting province is huge. It's actually shocking.
So we asked him if the teachers are losing their lives because the education department's COVID-19 protocols are basically failing them.
In fact, in school, the protocols are working. That's why after schools reopened, the numbers declined, which means schools contributed to the reduction of the infection rate. But the spike happened after schools closed because people in society, in their own homes, in the streets, there's no control. You go to a party, you go to a funeral, you go to other social activities.
Mhlanga says the disruptions to teaching will need a longer time frame to address.
If there are going to be any further disruptions, it means that it could take us and even longer, maybe 5 years even, to try and recover the loss just that would have resulted from a single year.
South Africa's 2020 academic calendar was revised at least twice to accommodate the changes that have been brought by the impact of the coronavirus. With less than a month before schools are due to reopen, Teacher Union SATU has appealed to the Education Department to ensure that pupils and teachers receive psychosocial support in order to deal with the deaths that have been brought on by COVID-19 pandemic.
What we did during the preparations for the reopening of schools when they were closed was to work with our NGO partners. We also worked with the Department of Social Development to provide us additional social workers, counselors who would come to school to provide support to our learners and our teachers.
South Africa has surpassed the 1 million mark of COVID-19 infections. The country is also currently battling a second wave of the COVID-19 pandemic.
China has stepped up its campaign to help Africa move up from the vaccine queue, where it otherwise may not get COVID-19 shots quickly. Rich countries have almost gobbled up available COVID-19 shots around the world, leaving Africa groping. China says something can be done about that. Correspondent Enoch Sikolia reports from Nairobi.
The scramble for COVID-19 vaccines is taking shape even as countries globally enter a new phase in the pandemic response, that of vaccination. The race to inoculate millions of citizens with the life-saving jabs is on around the world. But Africa is lagging behind. Hopes of vaccines early enough have dimmed, with rich economies having already purchased millions of vials from Western producers. African countries have been pushed to the tail of the queue. But African countries such as Kenya have already smelt the coffee and are increasingly looking elsewhere to guarantee supply of COVID-19 vaccines.
Even as we talk about the Oxford, the AstraZeneca vaccine, we are also negotiating with the others as well, including the Sinopharm in China. We are looking at the Pfizer's. We are looking at all the other vaccines that have been approved.
Kenya was waiting for a vaccine to be delivered through the COVAX facility, a WHO-led project working largely with Western manufacturers. But as reported by Kenya's Star newspaper, President Uhuru Kenyatta ordered the Ministry of Health to extend the search far east. The decision also welcomes the testing of a Chinese COVID-19 vaccine in Kenya. In Africa, only Morocco and Egypt are testing a Chinese vaccine candidate. The decision was made because the toll of coronavirus in Kenya is worsening.
We will not be relying only on one type of vaccine. The ideal thing to do is to use several so that you can increase also the chances of a higher efficacy.
Kenya believes that the timely supply of affordable and effective vials will not only cushion lives from the disease, but more significantly ameliorate the biting economic impact of COVID-19.
I'm cognizant of the fact that health interventions are critical to our fight against COVID-19.
Kenya is targeting to vaccinate at least 30% of the population at a cost of $110 million and has singled out priority groups.
We start with the healthcare workers because those are the first line. As soon as the first line workers, and the first line include even people like the police, the healthcare workers, the teachers who are in schools, students and so on. So we have got a system which we have issued.
China appears to be the ultimate go-to place for Africa
in developing countries in Asia and Latin America. Now, there are a number of reasons that makes Beijing a partner of choice in the global COVID-19 vaccine economics. The Chinese vaccine presents itself as being relatively affordable compared to Western alternatives. This makes sense for Africa at a time of unprecedented financial pressure. China has demonstrated its commitment to stand with Africa in the fight against the virus since the outbreak. Chinese experts were seconded to the continent to provide on-ground support to over 40 countries. This was followed by massive donations of essential commodities ranging from face masks, ventilators, testing kits, protective clothing, and medicines. Chinese leader Xi Jinping has from time to time reiterated the need for targeted international support that can enable developing economies to overcome the pandemic afflictions.
When we return, international news. Debate arises in Germany over privileges for people vaccinated against COVID-19. And later, sport. Tottenham's former boss, Pochettino, is PSG's new coach.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News. A fast-spreading variant of the coronavirus that has hiked infections by a significant number in Britain has forced Prime Minister Boris Johnson to impose a strict new national lockdown that will be in effect till the middle of next month. This lockdown will have significant impact on daily life in the country. Schools and colleges will be shut, shifting them to remote learning. Britons are urged to stay home except for necessary activities outside the home, including essential work and shopping for food and medicine. The new variant, said to be at least 70% transmissible, has been very active in London and southeastern London, causing infection cases to rise to 60,000 per day. Hospitals are being overwhelmed. It was Scotland that first announced a full-scale lockdown. There, the First Minister, Nicola Sturgeon, had consistently acted faster and moved quicker to try to stunt the spread of the pandemic. Cabinet Secretary Michael Gove said he hopes the gradual lifting of restrictions could begin in mid-February, but that the government will do its best to ensure as many people as possible are vaccinated so lifting of restrictions could begin. Before coronavirus vaccines were ready for acquisition by countries, Germany was debating how it would distribute the doses it would ultimately receive. Now that it has begun vaccinating its citizens, a different debate is raging over privileges for those who have been vaccinated against the virus. Correspondent Natalie Connie explains.
Yizhi Tao is the owner of this traditional Chinese massage studio in Munich. Due to Germany's COVID lockdown closures, he lost 50% of his 2020 revenue. Yet he's unsure if reopening for vaccinated customers makes economic sense.
If only vaccinated people are able to come for massages, then we basically have no business. It's going to take more than a year for everyone to be vaccinated.
He currently receives a government subsidy, but that could be cancelled if he's allowed to open for those with special privileges.
Well, any customer would be welcomed by most struggling businesses. The debate over this issue is robust, with many people arguing that such a policy would divide society and even challenge people's freedom of choice.
No. All people should be equal. It should be, everybody should treat it as same.
The vaccine is not available for everyone, and it's not free of charge for everyone.
In my opinion, it's not good. I have a chronic disease and can't get vaccinated because it would destroy my immune system completely.
Aside from the debate, there's concern over vaccine supply. Some vaccination centers have been closed until the next EU shipment of the BioNTech-Pfizer vaccine arrives on January the 8th. Away from Germany, the Dutch government says it will start vaccinating acute care workers ahead of its planned vaccine rollout on January the 8th. The country's late start to its inoculation program has caused public anger after other European nations began offering jabs late last year. Meanwhile, the French government is taking a much more muted approach to inoculations, as citizens there prove to be some of the most skeptical about the vaccine in Europe.
The cash crisis in Venezuela has worsened so much that the country has been pushed toward becoming a cashless country. While it is understandable, as inflation had sometimes exceeded 2 million%, causing the local currency to be so worthless, retailers now prefer payments in foreign currency, especially US dollar.
Venezuela is rapidly becoming a cashless economy. This was not necessarily planned. It just happened. After years of inflation, sometimes estimated at over 2 million%, the local currency, the bolivar, is disappearing. The government here has struggled to print enough notes. The US dollar is now widely accepted, but not officially. Ordinary customers can't withdraw dollars from local banks. That means there's a critical shortage of change, a situation worsened by the fact that, owing to COVID-19, Venezuela's borders are largely closed, so few new notes are entering the country. It's all madness, says the owner of this beauty salon in Caracas. But there is a solution of sorts. Mobile payments. These account for almost 20% of all retail transactions in Venezuela. An increasingly popular one is Zelle, a bank-to-bank US system. The funds go from one account to another in the United States and never even enter Venezuela.
Those who don't have dollars in cash or bolivars and have accounts outside the country, they use Zelle.
Despite the fact that much of the Venezuelan economy is sanctioned by the US, many Venezuelans do have accounts in the United States, or at least know someone who does. And that number is increasing as millions of Venezuelans emigrate from the crisis here.
Zelle accounts for between 15 and 17% of general commercial payments in Venezuela. It is one of the platforms with the greatest reach, which is surprising, as it is a platform for American banks, designed mainly for the US market.
It is, of course, ironic that this country, whose economy has been going backwards faster than any other for the last 7 years, may also provide a glimpse of the entirely cashless future that awaits us all.
Up next, sports. Tottenham's former boss, Pochettino, is Paris Saint-Germain's new coach. Please stay with us.
You are watching ANN.
Susu is fine. No, she's not crying, oh. But we are watching cartoon. Ask grandma, I'm the one that used to take care of Yabo that time. Take your time. I will call you back. Your dad is calling.
Explore without limits. Turn it up on MTN, the reliable data network.
Welcome back. This is ANN News. In sport, the Thai Federation of Nigeria says it has uncovered a visa racketeering ring that claims to be Muay athletes in an attempt to get Egyptian visas. NMF President Paul Egono says 30 individuals stormed the Egyptian embassy with fake letterhead and seal claiming to be representatives of the federation that was heading to a training camp in Egypt. Ogonu says the Federation has already written to the Egyptian embassy to notify them of the fraud, adding that none of the names listed on the visa application is a member of the Federation. MFN is a member of the International Federation of Mathai Association and also a member of World Mathai Council. 48-year-old Mauricio Pochettino is the new head coach of French champions Paris Saint-Germain. PSG announced on its website that former Tottenham manager Pochettino had signed a contract until the end of June 2022 with an option for an additional year. Pochettino's first major test to be the Champions League last 16 away leg at Barcelona next month. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatuji. Have a pleasant evening.